Good afternoon. My name is Lindsay Culler, and I'm an adult gerontology nurse practitioner student here at Clemson University. Today, I would like to present to you a case study. Mr. Jones is a 27-year-old Caucasian male that came into the office today. He complained of nasal drainage and discharge, congestion, and occasional sneezing. Mr. Jones's symptoms began 2 days ago with the sudden onset of fatigue and a low-grade fever of 99.5 degrees. He also had nasal congestion and yellow discharge. Mr. Jones also complained of a pressure-like headache that he has been treating with over-the-counter Tylenol. Upon the review of systems, Mr. Jones has no history of chills, night sweats, weight loss, or gain. Patient does report a low-grade fever of 99.5 degrees upon the onset of his symptoms. He has no history of diplopia, blurred vision, cataracts, glaucoma, hearing loss, tinnitus, vertigo, persistent hoarseness, dysphagia, no goiter or thyroid disease, but the patient does report a pressure-like headache upon the onset of associated symptoms. He has no history of persistent cough, sputum, dyspnea, pleuritic chest pain, wheezing, asthma, pneumonia, or hemoptysis. He has no history of chest discomfort, palpitations, orthopnea, shortness of breath, pedal edema, rheumatic fever, heart murmur, or hypertension. And Mr. Jones has no history of nausea, vomiting, anorexia, diarrhea, constipation, hepatitis, peptic ulcer disease, gallbladder disease, or abdominal pain whatsoever. His past medical history is very insignificant. He does report past allergies, but just seasonal allergies. In his past social history, Mr. Jones states that he does not smoke, but he does drink occasionally on the weekends. He has 3 to 4 alcoholic beverages when he is at social functions, but only on the weekends, and does not drink throughout the week. Mr. Jones is also sexually active with his partner, his wife. Upon physical examination, his vital signs are as follows. His blood pressure is 115/67, his heart rate 67, respiratory rate 16, and temperature 98.9 degrees. Overall, he is well developed and in no acute distress. He has facial symmetry, he is normocephalic. His pupils are equal, round, and reactive to light and accommodation. His ear canals are patent with no discharge. His tympanic membranes are intact without erythema, bulging, or retraction. His gross hearing is intact. His sinuses are tender upon palpitation. His nasal mucosa is moist, and no lesions are noted. His turbinates are swollen upon visual check. Neck is supple, trachea midline, no carotid bruits, no JVD, no lymphadenopathy, thyromegaly, or nodules. His chest expansion is symmetrical. Bilateral breath sounds are clear upon auscultation. Lung fields resonate with no tactile phlebitis. His respirations are regular and non-labored. Cardiovascular-wise, he has a regular rate and rhythm, with no rubs, murmurs, or gallops. Mr. Jones has no known drug allergies. His differential diagnoses are as follows. 1. Viral sinusitis. 2. Bacterial sinusitis. Or 3. This could possibly be a dental abscess. There are no lab work needed for a clinical diagnosis. His symptoms are actually adequate for his diagnosis. I will instruct the patient to follow a treatment regimen and return to the office if the symptoms persist without subsiding after 1 week of treatment. I will treat viral sinusitis in this patient, but if symptoms do persist for 10 to 14 days, this is indicative of a bacterial sinusitis and he may need to return to the office to receive an antibiotic. The only indication of drawing a CBC without differential, or with a differential, is if Mr. Jones continues to have persistent and chronic sinusitis without relief. Again, I will tell Mr. Jones to continue taking over-the-counter Tylenol for his headache. He will also take an antihistamine and a combination drug, which is a decongestant and an expectorant in one. He will take Claritin 10 milligrams once a day by mouth, and he will also take Mucinex DM 1200 milligrams twice a day by mouth. Again, if his symptoms persist without subsiding after 5 days of treatment, the patient needs to return to the clinic and be evaluated for bacterial sinusitis, At that time, a CBC with differential will be drawn and an antibiotic will be prescribed for the patient. Thank you.